So for those who don't know me, I'm Ted Zellers, and I'm the director of the Industrial Hygiene Program here in the Department of Environmental Health Sciences. And I'm hosting our speaker for today, and it's my great pleasure to introduce Marianne Levitsky to you. What I just learned yesterday was that Marianne and I have sort of common roots in the New York metropolitan area. We both have offspring, i.e. sons, who are living in that area and who are working in that area. So we have a reason to go back and reconnect with our own roots through them. So that's a little fun fact. Marianne got her undergraduate education here in the States and started in Chicago, ended up in Albuquerque, New Mexico. Then decided to go across the border to Toronto, and she got her master's degree in environmental health at York University, or is it the University of York?
York University.
York University in Toronto. And I guess something about Toronto must have resonated with Marianne because she has been there ever since. So she started her career, working her way up through the public sector in Ontario. She worked for the Ministry of Labour, the Ministry of the Environment. She worked for the Toronto Board of Health. She eventually made her way up into senior management positions that included the Director of Research Policy and Communications for the Ontario Workplace Health and Safety Agency. And then also she served as a director within the Ontario Workplace Safety and Insurance Board, both government agencies. Since 2011, she's been an adjunct faculty member at the University of Toronto Dalla Lana School of Public Health. And for the past 9 years, she's been a senior associate with a private consulting firm called ECOH, E-C-O-H, which does all sorts of occupational, environmental, and related consulting for, I guess, all of Canada, but still based in Toronto. Marianne is a certified industrial hygienist here in the U.S. She's a registered occupational health professional in Canada, which is their version of the CIH. And she's a fellow of the American Industrial Hygiene Association. Throughout her career, she has a whole long list of volunteer activities that she has donated her time to, mainly in advocacy for workers throughout the world, both in Canada, the United States, and then throughout the world. And her position as co-founder and president of Workplace Health Without Borders is really how I got to know Marianne. And through that organization, which is a non-governmental organization that is promoting occupational health for workers throughout the world, we are trying here at Michigan to grow a global occupational health effort. And it's partially through WHWB that's happening. We now have the U.S. chapter of WHWB located here in Ann Arbor. And again, we're networking with folks and trying to make more things happen. So in any case, that's a long-winded introduction, and at this point I'd like you to join me in welcoming Marianne, who's going to tell us a little bit about global occupational health.
Thank you. Well, thank you so much. It's been such a warm welcome. Can people hear me okay? Okay, that's great. I really appreciate this invitation to Michigan. I told Ted I really have to move here now because there is so much happening here in global occupational health. And you're such a warm, welcoming community. So I do really appreciate it. And as Ted said, Michigan is the hub. This place in Ann Arbor is the hub of Workplace Health Without Borders U.S., which we'll tell you a little about later. So you're really on the leading edge, I think, of global occupational health. Here are some of the things I want to talk about today. Why is occupational health a global concern, and what can we do about it? If I told you you'll get the answers to these today, that would be my April Fool's prank for you. I think the other April Fool's joke is that you invited me here to talk to you about this without telling me that you folks are like way ahead of me. You have people doing research on many of the things I'm going to tell you about today. So please feel free to speak up and embellish what I have to say, because some of you know more about this than I do. But at least maybe we can pose these questions and think about them together, and there'll be some time, I hope, to talk about them when I'm finished talking. So why is it a global concern? Well, for one thing, I want to phrase that as a statement. Occupational health is a global health concern, and my concern is that that's not widely recognized, that there's a whole community that's dedicated to improving health on a global basis that tends to give somewhat short shrift to occupational health. And I think we need to change that, and I think you folks are in a position to help change that. There are 3 billion workers in the world, and nearly 2 billion, or 2/3 of them, work in unsafe conditions, according to the World Health Organization. The global burden of workplace injury and disease, and mainly disease, is enormous. The ILO, the International Labor Organization, tells us that 2.34 million workers die each year from workplace causes, and 2 million of those are from disease. And that is one death every 15 seconds. So in the time that Ted started introducing me, there have been, maybe 10 deaths from occupational disease. Something that we often don't recognize. Another thing that we often don't recognize is the cost. So 160 million workers, in addition to the ones who die, get sick from occupational disease every year. And it's estimated that this is costing the world economy $2.8 trillion. That is amazing. So think of what we could do if we had $2.8 trillion more dollars that we could spend on solving the world's problems. This is an amazingly under-recognized and under-addressed issue, especially when you compare it to some of the other problems in the world, because we pay so much attention, and rightly so, of course, to problems like warfare and violence, to traffic crashes, to HIV and AIDS. But if you look at the numbers, and we just compiled these numbers from recent sources related to all these problems, you can see that deaths from occupational injuries and disease dwarfs all of those that get far more attention. So I think as people concerned about occupational health, we have a lot of work to do in talking to other people outside our field to say, you need to pay more attention to this. Just in case you're wondering where all those deaths are, here's a graph from that same ILO source. So you can see about 1/3 of them are from cancer, 1/4 are from communicable diseases. Well, that's very interesting, because very often when people die from or communicable diseases or get communicable diseases, we don't necessarily think of it as being workplace. There was a huge crisis a year or so ago about Ebola, which certainly the world was well aware of, but to what extent was the world aware that this was really largely an occupational disease, that the people getting sick from Ebola were the funeral workers and the healthcare workers, not recognized as an occupational health crisis. But these are just the official statistics. Even as overwhelming as it seems, it vastly underestimates the scope of the problem, because it doesn't look at the environmental impacts of workplace agents and the synergy between workplace hazards. Those of you in occupational health know a lot about the synergy of, one hazard interacting with another hazard to make the problem even bigger, such as asbestos and smoking. And also silica and tuberculosis. There's a lot of worldwide global health attention on TB, but very little recognition that a big contributing factor to that TB is silica exposure. There's also this huge issue of the informal workplace, and I'll talk a little more about it, informal work. Most of the world's workers work in informal work in many countries. And there's also blurred lines between the workplace and the home. We tend to think of occupational health as something affecting someone that goes to a separate workplace, separate from their home. So their environment, their community, their families are not exposed. That is not the case in most of the world, as I will get into in a little more. So let's talk about the informal economy a little bit. Has anybody heard of this book, Behind the Beautiful Forevers? It's not an occupational health book per se, and it won the Pulitzer Prize here in the U.S. just a few years ago. This woman is a journalist who spent a lot of time in one of the slums in Mumbai, documenting the lives of people there. And I found a clip. This was advertising her book, so it gives you a bit of a sense of what she found there. And she wasn't specifically writing about occupational health, but that's what I took from it. So I just cut that there so you don't, we don't take too much time on it. But, whoops, I'm supposed to have another little, there, yes. What I took from that book was that people don't go away to work, that people live in this slum, and essentially the way they make money is to harvest the garbage, everybody's garbage, that is there in the slum or that they go out into the city to gather. And the reason the book is called Behind the Beautiful Forevers is that the slum is located behind billboards that were advertising some interior decorating products called Beautiful Forever. And this is what's behind those billboards. And these people are living there among this garbage, and they harvest the garbage and they sell it. And there's pools there and ponds there, and the journalist fell into one of the ponds and discovered that way that it was just full of chemicals. And this is what people are living among, and as you can see, children are playing among. This is occupational health in many parts of the world. It's not somebody going off to a separate workplace. It's been estimated that in the developing world, employment in the informal sector may reach 70%, and contributing as much as 10 to 60% of GDP. So a lot of what we're talking about is the informal sector, and if we're going to address global health, we have to address the informal sector. This was my own, some of the pictures I took myself when I was in Tanzania and Dar es Salaam last year. And again, somewhat informal work. People do welding and repairing of largely automobiles and whatever somebody wants them to repair, and they work on the street. And this was like a block away from my hotel, so it's not like somewhere far away. This is like right in the city. And you can see people are there on the street, just welding on cars. This was a person on the sidewalk. I just turned around and took a picture of him as I passed. You can see he's smiling. He's just sitting right in the middle of the sidewalk, and people had to walk around him as he's working there. And I took a bit of a video clip of people welding. So the hygienist can tell you what's going on in this picture in terms of exposure. I'll play it for you. So, any hygiene comments about that clip?
Everyone's watching it at work without eye protection. Yeah. He's got some eye protection on.
Yeah, he's wearing like these like $1.50 sunglasses you can buy at the, down the street. That was what they're wearing for eye protection. Yeah. Mm-hmm. So, and if you ask people, and this is one thing that I've found pretty much, wherever I went or talking to people who've done research like this, it's not like these people don't know the hazards. You ask them, what do you think are the problems? My lungs, my eyes, my hearing. They know it's hazardous. It's not a matter of educating them that it is hazardous. It's what can you do about it? What can you afford to do about it? And obviously no protection from the fumes that he was getting from the welding.
Nor protection for you, as you're sitting there filming.
Right, well, right, or the people walking by. Yeah, that's right. So again, are we dividing environment from, what are they? Are they welding on stainless steel? And I think the hygienist will be able to tell you some of the metals in stainless steel. That's just going into the environment in situations like that. And it's not only affecting adults; it's affecting children as well. So the ILO again estimates 168 million of the world's children are child laborers, and more than half of them do hazardous work. We have a program in Canada, maybe you have it here too, called Take Your Kid to Work Day. Do you have that? Yeah, so I used to participate in that when my kids were younger, and once a year everybody would bring their kids. They'd see what we do. Well, in most parts of the world, you don't need a program like that, because every day is Take Your Kid to Work Day, because the kids are right there. they're in the workplace, they're living with the parents don't have childcare. So if they're not living right there, they have to bring their children with them to work. So here's some kids in a brick plant. Here's a picture I took in India, and I'll tell you about this project more in a little while. But this was, we went to do a project where we were installing some local exhaust ventilation with some agate processing. And you can see this is where they're working. So this is set up like on the little porch outside their house. And there's another wheel here. So they're grinding agate, which has very high silica exposure. And here's some other people sitting around doing some more. And you can see it's like this is the community. Everybody's sitting around just being exposed to what the workers are exposed to. And here, including some children. So it's not a matter of separating the exposure from the family. This is a picture I took in the same community when we broke for lunch, and I was sitting in a restaurant, and I looked across the street, and this is what I saw across the street. So this family's up there, and I have more of a close-up. So here's what I saw. So here's this family constructing on the second floor of this little building, and the whole family's involved in building with these bricks, and you can see the women are carrying the bricks, and there's a little child. Can you see that? Maybe she's 4 or something, helping with this and pouring the water, and very close to the edge of this roof. I think this is supposed to be the barrier, so there's some barrier there, but obviously it's not very much of a barrier. So having children exposed to hazards is very common in these situations. Also with lead poisoning. So some people here are doing some research on artisanal mining. It's an issue we're greatly concerned about. And here's a clip from Human Rights Watch, did a video about lead poisoning in Zamfara, Nigeria. So I'll play this for you. The first words are in Zamfara state. It's hard to hear, so that's what it says. In Nigeria's Zamfara state.
Nigeria's Zamfara state, the discovery of gold has brought prosperity and hope to its people, but the process of mining the gold has had deadly consequences. Lead released in the gold mining process is poisoning children. Hundreds have died, and thousands more are at risk in what's considered the worst outbreak in modern history. Zamfara has huge deposits of gold. With the rising demand for gold, the people have increasingly turned to mine to eke out a better living. In this area, lead poisoning is a deadly byproduct of the search for gold. Miners crush and grind ore, and in the process, they release dust that is heavily contaminated with lead.
Shi gaskiya ba ma samu zuwa yanzu ba asibiti ba don ta kama shi karfi cikin karamin lokaci wallahi kafin a kai matakin da asibiti ba ya yi shi. So gaskiya wannan da ya ko da ya kama shi wannan daga baya gaskiya kusan ba ne don ne amma wani suka bayani na mun kusan yadda wancan ne na farkon haka wannan shi ma ne. So ito ainihin wannan ma'adin zinari ita zai iya nika haka ko
Okay, I think I'll stop that because just in the interest of time, because there's not too much time. But this has been a major crisis, and the CDC has been in the U.S. CDC has been involved in an investigation here, as so has Doctors Without Borders in this. And that was particularly bad in Nigeria because of the lead content in the ore. But certainly poisoning in artisanal mining goes on in many, many places. Especially mercury is a particular problem in artisanal mining because mercury is used to extract gold from the ore. And this kind of thing is going on everywhere. And you can see in this case children, because they're doing it in the community, or sometimes children are even involved in doing that mining, that there's a huge crisis in terms of child health. exposed to these hazards. So what needs to be done? Well, again, that's a question for us all to ponder, if not answer. But we'll talk a little bit about, what are some of the different issues in terms of hazard control being a priority for international health agencies. Unfortunately, I seem to see, I think, a lot of attention on characterizing the exposure, on the disease, but very little on prevention. And I think those of us in the occupational health and hygiene professions have a lot to offer in terms of how do you actually prevent this. And that's what we need to turn our attention to now. Of course, there's a lot that governments need to do in terms of policies and standards, but very often you find the policies and the legislation are in place, it's the enforcement and the follow-through that's lacking. Certainly been a lot of attention on corporate standards and corporate social responsibility, but problems in terms of how far down the supply chain does that go, and I'll talk about that in a minute. Certainly we need to have the workers engaged in and participating in the solutions. And we need to bring the knowledge and resources that may be lacking in those areas. So in terms of corporate standards, they said we need to think about the whole supply chain. I'm just going to skip ahead to that part. So a lot of this problem are supply chain problems. We're all part of an international supply chain, as well as I call it, there's also disease chain. We can often see this chain in terms of microbes. I call microbes without borders. They don't respect international boundaries. We can see how quickly the worry spread because of Ebola, right? So that was the one time when we had the Ebola crisis, the one, if you can call it an advantage, it was not, but what it did was highlight for us that we're one world. We all share this together. We need to think about that, about these inorganic hazards and the other kind of hazards in the same way. This is something that's shared around the world, and certainly when it comes to the kinds of exposures we're seeing in terms of mining, in terms of electronic waste, we do share this because we're all part of the same supply chain and we're all implicated in it. We also share common hazards like silica and lead, as well as there are common industries that are exist in many, many parts of the world where I think we can bring some collective synergy to solve. If we can address a problem in one area, we can spread that around and try to solve it somewhere else. So we often don't think about, we've been sensitized somewhat to problems of where our goods are produced through the tragedy, especially the tragedy in Bangladesh recently, where we became aware that the clothes that we wear are produced under really hazardous conditions. But we often don't think about how we're part of the whole cycle of supply. So not only consuming products made under hazardous conditions, but then we recycle those products. And actually, this is where people here, I know, can tell you a lot more than I can because you're doing a lot of exciting research here on electronic waste. So all the cell phones, et cetera, that we're using have to go somewhere. And where are they going? They're going largely to China and somewhat to other countries as well, where they're recycled and recovered under very hazardous conditions. And not only that, to our great shame, we are actually exporting hazardous materials that we no longer use in our own countries, and we're sending them abroad to be used. And I'm from Canada, and I sort of participate in that shame as well by being Canadian. So both Canada and U.S. companies export lead. We no longer use lead-based paint in our homes, but we have companies here and in Canada that are still making and exporting lead-based paint, which is really should be criminal, I think. Certainly asbestos, something that Canada is very guilty of. Canada closed its last asbestos mine just a little more than a year ago, thankfully. They didn't close it out of any moral reasons, unfortunately. They closed it for economic reasons, but at least they closed it. Until then, they were still exporting asbestos, trying to convince people that chrysotile is not as hazardous as other kinds of asbestos. So fortunately, our media did pick up on this. Here are some photos from a story in the Toronto Star about use of Canadian asbestos in India. I skipped that. I meant to have a slide here, but I did think I'd mention Workplace Health Without Borders was invited to India just last month to investigate asbestos contamination. And this gave you an example. We don't have results yet, that's why I don't have a picture. But the circumstances were interesting because what had happened was asbestos had been used many years ago in this plant, and the people who lived around it got waste from the plant that they used as infill for their properties, because they wanted to build on some, they needed to level out their land, and they took waste from the asbestos plant. And so now they have this property and these large tracts of land that are contaminated with asbestos. In addition, as I mentioned, we know we're consumers of hazardous products made under hazardous conditions, and this is a picture of the Rana Plaza factory after its collapse in Bangladesh, which has gotten so much attention. And plus, of course, hazardous recycling of used products. About 20 to 50 million tons of e-waste, and again, I should ask Rick and Kristen, I don't see them, but I know they're here. To tell you what they've learned, because they know this more firsthand than I do. About 70% of the waste is shipped to China, and whole families live right in the areas where they collect the waste, exposed to incredible potpourri of hazards, including lead, cadmium, dioxins, from recovering, often burning this material. I have a little clip from, they're not just working, but also living in these e-waste areas. And I have a clip from an Australian news item on e-waste area in Ghana, which I think some of you were there, right? So you can tell me if this is the place where you were.
For years now, we've been exporting most of our dirty industries overseas. And now it seems we're doing the same with the most dangerous junk that's left over from our consumer goods. We've been led to believe by many manufacturers that our used TVs and computers are being safely recycled in Australia. But on a recent trip to Africa, Dateline's Giovanna Vitola found that a staggering amount of the world's e-waste, including Australian waste, is ending up being burnt in open dumps in impoverished Ghana. It's creating an environmental and health nightmare there, and it's breaking a myriad of laws and conventions that are meant to be in place here. Nice laws, but things look rather different on the ground. Take a look.
Is this where you were? Yeah.
This is Africa's biggest electronics wasteland, where thousands of old computers and TVs are dumped every day. Amos is just 15 years old. Each day, he and his friends come here to scrape together a living.
And what do you do to get money? You are going to take this copper.
Their aim is to melt the plastic of these wires to try and salvage the small amount of copper inside.
Okay, so again, I stopped it just in interest of time. But you can see that just probably looking at that, if you have any inkling of what's in those materials, including plastics, what they're being exposed to when they're burning that off. So there's been, I wonder if I missed something here. There's certainly been a change in awareness among corporations. I mean, here's a quote from the Toronto's Globe and Mail from 1997, when there was a surfacing of concerns about how Nike products were made. And a Nike spokeswoman said, that's not Nike's responsibility. These are not our factories. It's become clear since then that that is not acceptable, and the public won't accept that kind of reaction. What was happening there, what happens in Bangladesh and in China, is that these companies outsource the production. So even if they try to look at the factories that they do direct have direct dealings with, they're not looking at who those factories are then outsourcing to around the corner under horrible conditions that are invisible to the parent company. A journalist wrote a book called The China Price, in which she found that Chinese factories simply could not produce goods at the cost that was being demanded. So Garrett Brand, who I think some of you have heard speak, is very eloquent on the idea of the disconnect between corporate social responsibility and the production demand. So on one hand, you have corporate social responsibility folks saying, you need to produce this under good conditions, and then the production people saying, yes, but you need to produce this many at this price. And those things just cannot go together. So what do those companies do? They just outsource cheaper to someone where the horrible conditions are invisible. And that's the kind of supply chain problems that we need to address and stop.
If I could add, so Garrett also made the point that, you know, this corporate social responsibility has become a billion-dollar industry in and of itself. Companies will hire people to essentially make their image look better. And what he pointed out was that if a CSR company shows the company to be bad too many times or too much, they'll just fire that company and find someone else who's, you know, will make them look better. So there's that threat also. So the incentives are at odds.
Yeah. Okay. So there has been some transitioning in CSR, corporate social responsibility, to a recognition that they have to look beyond those that they directly deal with. And of course, there's some non-governmental organization charities that are addressing this, including Garrett's organization, which is MHSSN, and a range of others, some of whom you may know. And one of them is Workplace Health Without Borders, which is the organization that I chair and that Bert and Cheryl, who are here, you might want to wave, and are on the board of for the U.S. branch. So I'll just mention a little bit about why we started. This grew out of the recognition that there's a huge gap in knowledge worldwide on occupational hygiene, we call it that in Canada, or industrial hygiene, and occupational health, occupational medicine, compared to the kinds of levels of expertise we have here in Canada and the U.S. And in the developing countries. So people who have looked at this have said, if we had the same number of certified industrial hygienists in the rest of the world per working population as we have here in the U.S., we would actually need 44,000 more occupational hygienists throughout the world. There are only 7,600 people in the world who have certification, and not just CIH, Certified Industrial Hygienist, but something comparable for another country. So that's a huge gap in expertise. And that was one of the reasons why we formed this organization, because we thought there are a lot of people looking at health issues, but they don't have this kind of lens of occupational health and hygiene in terms of what do you need to know, what do you need to do, what resources do you need to prevent these kinds of exposures. And that's something that we're hoping to address. So we have a vision and mission, and these are actually the new draft vision and mission, so even the members may not recognize these, because we've just been having a series of meetings. So the change we just made to our vision was we added the families and communities. So our vision is a world where workers, their families, and communities do not get ill because of their work. Originally, it was just workers. And after having some of this experience I've described to you today, we realized it's not just about workers. It's really about everybody. And our mission also, we've changed that a bit also. So we used to talk about the occupational health professions. We've just tried to make it more inclusive because we're open and welcoming to anybody who wants to join in this kind of work. So the mission is to prevent work-related disease around the world through shared expertise, knowledge, and skills. And certainly that's something we can all share. And one thing we've been finding is we need a lot of expertise outside of the traditional occupational health hygiene expertise. So people who are good in communications and policy and public health and promotion and all that stuff. We need everybody to join in this kind of work. So here are some of the things we've been doing. We do some training programs, and our training has been so far anyway, largely geared to at the paraprofessional level, because we find in a lot of these countries there are people who work in in health and safety or public health in some capacity, but have not been exposed to occupational health and hygiene. So we've offered some courses for those. So here was a course we taught in India to physicians. Here's a course we taught in Tanzania last year. And I could tell you more about those courses. If anybody was here for Nancy McClellan's talk last year, she's with a group called Occupational Hygiene Training Association, and we teach their courses, which lead to a kind of paraprofessional qualification in occupational hygiene. We've also helped facilitate donations of equipment. So we've had some generous companies that donated their equipment, and they donated some pumps to Muhimbili University in Tanzania. We also had 3M donated some PPE to Sierra Leone University that needed it, and hospital that needed it during the Ebola crisis. We have a mentor program, and this is one thing I think can be very useful, because even if somebody takes a course in a country like Tanzania, they may not have any other occupational hygienists or occupational physicians around closely to help and guide them through their careers. As many of us have had, and as many of you probably have, as you do your work, there are always more experienced people around you can go to talk about, to teach you how to do things, or to just chat about some problems. And they may be the only person with that kind of expertise in their area. So one thing we can offer is that, well, we can do that for you, but we could do it remotely. And we use Skype a lot and similar things where we connect experienced hygienists or experienced physicians or nurses to people in these developing countries. We also address hazards in industries with shared problems around the world. So, for example, a lot of our work has just happened to deal with silica. Silica, I'm sure all the hygienists here know, is closely linked to tuberculosis. It's carcinogenic, it causes cancer, and it also leads to severe lung fibrosis, silicosis. And it's something that's ubiquitous because it's kind of everywhere. But when it gets ground up really, really fine and gets inhaled into the lungs, it can cause those kinds of diseases. Otherwise, it's just, it's in sand, it's in brick, it's kind of everywhere. So a lot of our projects have involved silica because it's often a common shared issue that we can get together around. And I'll just mention a few of those. Estimate about 10 million, millions of workers are exposed. I think the ILO didn't even try to say the number of millions exposed to silica. But 10 million in India alone were exposed. And here's as well silica in brick construction. Bricks are made in many places under fairly rudimentary conditions where the silica exposure can be really high. Is another one of our members that did a project on silica exposure in construction in Mozambique.
He's a U of M alum, by the way.
Oh, is he? Yeah, that's right. Yeah, right. It's amazing. Everybody comes back to UVM. That's neat. Oh, great. Stone quarrying in India, that's another thing that we've been involved with, and we have a brick plant project. So one thing that we can do is bring together people researching something in a number of different countries and bring them together because the conditions are very similar, and who can work together on grants, grant proposals, or just sharing the knowledge. So we've worked on brick exposures in these countries. The ILO Child Labor Project has been very involved in brick exposure, estimating that there's a huge amount of child labor in brick production. And the highest exposures are removing baked bricks from ovens. And here's some results from sampling for silica in brick industry in Pakistan. That was done by a center in Pakistan. And you can see, this is the column of interest in removing the baked bricks. Those of you who kind of know what the exposure levels are, kind of know these are astronomically high exposure levels for silica.
The proposed new PDL is 0.025.
Yeah, 0.025. Yeah. So you can see how enormous that is in terms of the exposure. I think I probably have to pick up the speed here, right? Because you want some time to talk, and some time for questions. So we also did a project related to agate production, and this is what those nice agate stones, it produces gemstones, and this is kind of what they look like when they're processed. Well, in India, you have people who are grinding these stones and polishing them, and they're generally doing them at home. It's estimated there are 1 million exposed, and the prevalence of silicosis is 20 to 30%. Silica levels, actually, we've measured higher silica levels than that. Not necessarily that somebody was exposed 8 hours a day to them, but very, very high silica levels. So we did a project in India about it, and I probably could take more time to tell you about it. But this is a great example of children being exposed. And I showed you earlier a picture that I took. This was from a video. We had some students at the local university there do videos in Gujarati, which was for promotion purposes. And this is still from their video. So you can sort of see this is a fairly typical situation where people are working right outside their home and the whole family and the children are around getting exposed to the silica as well. I don't think I'll tell you a lot about that right now, just for time. We did have one of the main researcher at the University of Toronto then went and tried to explore with them, well, why are you not using, they knew about local exhaust ventilation, but the government had installed some about 10 years before, and it was all gone. They weren't using it. So there's clearly, it's not just a technical problem. I mean, we have to find out what the barriers are here. Why weren't they using it? So our first visit was about talking to workers and interviewing them and finding out. What are the problems here? We can't just assume that the solutions we have here in the developed world are just something we can import and plant in a different place. So we learned a number of things there. One, power is a big, big issue. So we might design the optimal local exhaust system. They couldn't use it because they couldn't afford the power to run it. Not only that, it needed to be portable, because they were afraid, you put an expensive motor and you leave it outside their home. As you can see, they're working outside. If you leave it outside for a night, it's going to be gone in the morning. Somebody's going to regard the metal, if not the motor, as extremely valuable. So they're going to have to bring the whole assembly inside. So here were two very real constraints in them doing anything about it. So our PI did some work in his lab at University of Toronto, and his idea was to use some local materials. So he ended up using, I thought I had a picture here. Yeah, we ended up using something with buckets that could be, actually he had a really clever design where he used a traffic cone as a cyclone, because we thought, okay, traffic cones, there's a lot of them. Turns out they don't use traffic cones in India. I don't know if anybody's been in India, but traffic control is not their high priority. So they said, no, we don't have traffic cones. So we had to just actually get somebody, a metal worker, to manufacture some cyclones. But they have lots of buckets. So we ended up using buckets as dust capture. I thought I had a picture of that, but I don't have it here. But we did have some success. Here was the vertical grinder. We used, you can see the quartz or silica is 1.2. With local exhaust, we got it down to 0.1. The other thing is that what's really important to us is that we engage the workers in designing the controls. So this, I kind of really like this. You can see when we would bring a hood into a place where they were using it, everybody gathered around. People really like gadgets, right? They really like technology, and they all get really excited about it. And so everybody came around and they sort of helped design the hood. We brought a hood and they said, here's how you can make it better. And they got, they knew what they needed to do. So I think a lot of what we need to do is engage people in telling us what the barriers are and how we can fix it. Also, we need to stretch our concept of what industrial hygiene is. So how do we remove children from exposure? The problem is children are hanging around where the exposure is. And this partner that we work with there, they started daycare. So we can remove children from that exposure. We don't think of daycare as being industrial hygiene. We need to expand our thinking, removing children from exposure. So there's certainly a big movement to, improve education and get children into schools. That's important in itself, but it's also important in terms of removing them from these hazardous conditions. So out of that, we just are writing it up now. The project, I'd say the local exhaust ventilation we installed was moderately successful. We think it needs to be further developed. But we also got, the intent of that project was to develop a toolkit, we called it. We called it that because it just seemed, kind of good jargon for the grant, but it ended up being a useful concept of having a suite of a way we approach things if we want to do other projects in other places. And so the idea of this toolkit is predicated on the idea that wherever we go, there's likely to be some local organization that's in a position to help to work with the workers and have some concerns about their health. But it doesn't have to be an organization that's involved in health or has a health or hygiene expertise. They just need to be concerned and willing to be the, our interface with the worker community, because we can bring the occupational health and hygiene professionals to help. And so it's the combination of those partners where I think we have potential to do something new, and then to use the global health network that we have. And what we're getting from electronic communications is just amazing. So we have a network now of 600 people around the world, and we meet monthly by teleconference, and we do have participants from all over the world, which of course we couldn't have done a decade ago. So the potential that we have now to do amazing work, often without even going anywhere, is quite incredible. And I've been talking this morning with several people and just getting very excited about the potential for the kind of partnerships we can develop here and that you can develop with other universities or other professionals in other places, in other parts of the U.S. and in other countries. So the potential that we can build on because we're willing to work together and we all have common concerns, I think can make some major changes. Right, so here's just the toolkit elements are just really a stepwise idea of how we assess and address a problem. And we developed a few tools, a few elements for the Agate project, which we can use, but a lot of this is just accessing things that can help us do this everywhere. Some of the research and development needs, it would be great, like you have students here who do projects and people looking for research topics, and I think that's another way we can do something really exciting, is just identifying what some of the issues are. For example, we identified, because of the Agate project, this problem with local exhaust ventilation, and we just using it in a way we use it here is just incredibly difficult. Is there something we can design that would make it more usable in developed countries? So something that would be energy efficient, or maybe would use renewable energy. So solar-powered local exhaust system, for example, or wind-powered. So there's a committee that's been started in WHWB, and there's a group of engineering students at Arizona State University that are tackling this problem. There could be other similar problems. Another example is respiratory protection. Sort of almost all of these places where there's dust, you'll see people will tie a bandana around their face. They know the dust is a problem. And we, as hygienists, we always say, well, that doesn't do anything. Well, does it? Does it not? Can maybe there be some simple, low-cost, reusable bandana or material that will actually provide some respiratory protection? There's actually been some research on this. There's a possibility for more development in this area. Other common hazard exposures. Well, I showed you the welding problems. There are probably some really simple solutions that might help people in that kind of welding situation all over the world. And that's very common. I did look that up, that kind of welding, street welding. And it's very common in many places, and there have been studies done on the kinds of exposures those people have. And of course, artisanal mining and e-waste are issues that I know you folks yourselves are working on, and I think there's a lot of potential to do something on that. The informal sector, it'd be great if any of the students wanted to do some research on the informal sector and how to reach them. And there's possibilities here beyond the occupational hygiene for health communities, just for public health and global health in general. How can you reach these people? How can you make some changes? So that's, I don't know if there's any time, but I really wanted to have some time for discussions and questions and reactions.
Well, let's first guess some of you may have to leave it too, but if you'd like to ask a quick question before you go, you're welcome. And those who can stay, please do, and we'll continue to study questions right now.
Have you addressed, or we talked about thinking outside the box and how daycare would have to be an industrial hygiene concern. Have you had any projects or worked with anything that dealt with pregnant women?
Well, not with WHWB. No, I mean I have personally, but yeah, no, WHWB hasn't. No. Yeah. Was there a particular question you had about it?
No, I was just curious.
Yeah.
If it came up in any of the projects with WHWB.
So
Or with your own personal experiences? Was it with overseas?
No, it was in Canada, and actually I did some policy research on that because at the time in Canada there was like special protections. Well, the whole idea of lead, I don't know if you have that here, but there used to be a different lead standard for women than for men, right? And what are the implications of that? And the conclusion was there's no reason to have different standards. I mean, we should be protective. To be more protective for women discriminates in a whole lot of ways, right? It discriminates because women will lose job opportunities because of that. At the same time, the men won't be as protected. So, I mean, I'd sort of rather kind of make something protective enough for the most vulnerable than to have different standards for different people. Yeah.
Yes.
When you're implementing some type of control, whether it's engineering, at what point do you back away and completely just dissociate yourself from whatever control you implemented? So, like, it's kind of taking yourself the road and machinery that you gave the community breaks. How do you transfer control?
Yeah. Well, we haven't solved that problem yet. I mean, we're a new organization. I mean, one thing maybe I didn't have time to tell you is that we're a very new organization, and we haven't had enough time to follow through. But we've certainly identified that as an issue. I mean, one of the things that that's come out of what we would like to do in something like the Agate project is come up with something ongoing. I mean, we know we can't just bring in equipment, especially somewhat sophisticated equipment, and just leave it and walk away. Like, you can't do that. You have to have something ongoing. So you have to be able to tell people how to maintain it, what to do with it. We have to have enough resources to go back and check that it's being used properly and to do any maintenance if that's needed. So I can tell you what the ideal is. I can't tell you what we've done because we haven't done it.
Well, the whole notion of capacity building, I think, is at the heart of a lot of efforts globally. And, the training that WHWB does in conjunction with OHTA is designed to build a quasi-professional class of people who are trained enough to do understand what it takes to implement these kinds of controls and sort of take charge at that level, at least, and then slowly build it up to the level of professionalism we have in Western. That's part of it.
Yeah.
Is there much receptivity for engagement with WHWB among the larger businesses and organizations in these countries? Because I know with like Rana Plaza, there was deliberate disregard for the health and safety standards.
Yeah. So far not. I mean, I can't say that they're not, but we haven't really had that. Like, did Garrett Brown speak to this group, or did he?
No, he spoke to a class that
Okay.
Chris used to be at, but he doesn't.
Yeah.
No, just a subset of the students.
Oh, okay. Because Garrett Brown, who's involved in one of these organizations I mentioned, is doing a lot of work now in Bangladesh. So he is involved with a group of companies that say they are receptive because it freaked them out so much, the Rana Plaza collapse, that they are now, agreeing to have training, to pay for training, etc. But it took a Rana Plaza for that to happen, and we don't see that necessarily happening elsewhere. I mean, one thing I did see when we did training in Tanzania, it was just open to students to register with the university. And it turned out that half of the students were from the mining industry. So, unfortunately, the bad news was most of them were paying their own way, so their employer was not even paying for them. But their employer obviously agreed in some way for them to go. So there's gradually being some expertise being built up, or at least interest among the staff of those, and these were multinational companies, of getting some expertise among the staff. But we haven't seen the companies kind of rush to the forefront of improving this.
But the one thing, the way Garrett described the outfall from Rana Plaza, there are some substantive changes going on. They've really made, they're not just paying lip service. There are accords and things that are in place now that are, putting hefty fines behind people who don't comply, putting restrictions in about having contracts and not backing out of them just because a plant or a place gets inspected. So it sounds like there's some significant work going on, though there's a limit to how long this sort of level of scrutiny will be maintained. And so you worry it's a couple of years from now where I think they're going to sunset these programs, and you worry about it then. But sad as it is that it took something like this to precipitate it, there seems to be some real changes going on.
And you can say, I think that's largely due to the consumer attention to that. It's like that's what got those companies' attention. Well, for one thing, they were producing consumer goods, so people were readily aware that they were buying the clothes that were made in Rana Plaza. And that went a long way to getting the companies on board. We have to see that happening elsewhere. And people, that's one thing that the public and, everybody can do is be involved in making people aware of the conditions under which the things they buy and use are made. Yes.
Rick?
So, Marianne, great presentation. I'm just curious, has WHWB taken any specific measures or approaches to avoid crossing the line between capacity building and sort of finger wagging and, how to do this best, you need to just listen to us and do what we tell you to do, basically?
Have we crossed the line? I don't think we have. Partly, we're new, so I can't say we have so much experience that we can swear that we never do that. But from what I've seen so far, I think we're very conscientious about being receptive to people's experiences and respectful of what they know. And I think that's like key to any of this kind of work. Is, these are the people who are the experts. They're going to know.
Right. So maybe that's one pointer you would have for others who might do this sort of research.
Oh, absolutely. Absolutely.
Sort of cultural respect, but any other ideas or suggestions? Yeah, for sure.
Well, just start with more information gathering than telling, right? And don't assume anything, I guess, might be a good starting point. Certainly don't assume that these people don't know what the problem is, right? At least find out what their understanding is of the problem. We often think we need to do education, like we need to tell people that silica is really harmful, going to kill them in 20 years. You know what? We didn't need to tell the workers in India that, because they're dying right now. They see their family members dying. So we go in to educate them that silica is harmful, we're like not being any use at all. So we need to find out, really just hear them first in terms of where they're at and what they know, and designing solutions. I think that's one where we can help is say this can really help you if we draw the dust away from where you're breathing, or if we use wet methods, and what do you think will work? How can we do that? And they may be able to come up with the solutions themselves, or at least tweak them and adjust them so that it works for them.
John, did you have?
Yeah, I'm pretty sure you probably talked about this with the other faculty members, but I was wondering what your scope of e-waste work was in terms of affiliation.
Oh no, we don't have e-waste work. I was looking to this group because you're doing so many. I know people here are doing exciting things with e-waste, and it's certainly a universal, very widespread issue. So it's something we're quite interested in. So happy to talk about that, but we haven't started anything there yet. Yeah. Yes.
Are you planning on partnering with any industries to fund projects in the future?
So I can come around here. Partnering with industries?
Any industries to fund future projects?
Yeah, we'd love to. Yeah, anybody wants to get some? Yeah, we'd love to. We have a plan. We're a very poor organization. We're non-profit, let's call it charitable status. It's like 501c3 here, in Canada. And also there's a 501c3 application here that certain Cheryl here are involved in. So when that happens, we'll be able to get tax-deductible donations here. We already can in Canada. We've raised some money largely from individual donations and a few from companies. But we're still very, very poor. We don't have enough money for staff. We don't we have enough money for a little bit of seed funding for projects and for some travel expenses when we do training. That's about all we can cover at this point. But we'd like to raise some more money. So there's enough, we have a strategy, plan to go to approach corporations, to approach foundations. But also a lot of our work would probably be grants, like on a specific project. So if we bring together a group focusing on a particular issue, then that group can decide to go after some grants. We may be able to pool our expertise, our knowledge, our contacts to be successful in grant applications.
So if I could just amplify on that a little bit. So, I'm putting on this course on global occupational health, and I'm learning as I'm going. And one thing that I thought was interesting, we found out that the Gates Foundation and the Ford Foundation, two of the bigger, philanthropic organizations in the world, there's no explicit occupational health funding effort that they are supporting. Perhaps indirectly, but not directly. It doesn't make it onto the radar screen. And one of the several initiatives I'm trying to get going here at school is to tap into our pretty extensive alumni network. Many of the members of which are now in companies and in positions of influence. And we've made some inroads with General Motors toward this goal, but to try to tap that resource and see if we can bring it to bear, probably through WHWB, in fact. So that's one thing we're trying to do.
I think a lot of the potential is that we have partnerships now among universities, among charities. We'll have charities, and different funders can fund different things. Like some places can fund a charity and can't fund a university, and vice versa. Plus, we'll have partners among industry, people who work in the private sector, in the industries, or as consultants. So I think that's where there's a lot of potential. Synergy is just bringing together people working in many different arenas.
Yes.
So I was wondering, does WHWB focus more like workers in informal section other than workers like formally hired? And when you do things in another country, who do you actually talk to or collaborate with to improve the work?
With what?
So how do you make your inroads in other countries? Who do you actually collaborate with to do the projects that you're doing?
Really, the answer is whoever will work with us. The model is based on it depends. We need a partner. We can't just go in and plunk ourselves down without a partner, right? We need a partner there. So who have been our partners up to now? Either a nonprofit organization, so that was the case in India, it's another who was involved with the workers but not so much with the employers, or a university could be a partner because they might be, like in Nepal, we're involved with Kathmandu University, which is doing projects related to the brick plant. The informal sector is important to us for two main reasons. One is it's a really big issue, which I tried to stress, a really big problem that has not been addressed. But also, there may be some advantages in terms of us reaching them through community groups because we don't have to go through employers. We're certainly not opposed to working with employers, but sometimes employers may be resistant to us coming in. And sometimes it's a big mix. So here's an example of agate work in India. It wasn't one or the other. It's not just the informal cottage industry or factories. There were small agate factories which have almost exactly the same conditions, except for not having the children around, as the small cottage industries. The equipment was the same. Exposure was the same. So we went to one factory where the employer was very receptive to bringing us in. He wanted to find solutions as much as we did. So there will be employers like that. So we don't have to decide. It's not either or. Because if it's a small employer, there may be some workers that come together to work for a small employer, and there may be some that work on their own. And you need to be open and not necessarily create divisions among those different work situations.
Yes, me too.
Is there a way to propagate what you're doing right now in India or elsewhere? Like, you work with one employer and he was receptive. Is there a way to find more employers who would help?
Yeah, absolutely. Yeah, that's certainly something we want to do. That's part of the model. The whole thing with the project in India, for example, is that everything we were doing was really a pilot or a prototype, really. And once we get something that works well, we need to disseminate that.
Well, you hope that it'll, if it works well and people see the benefit, that I guess it's word of mouth, maybe the way you describe it.
And getting funding too. I mean, that will help get funding, and then you'll get more money for more equipment. I mean, because we can do a lot with volunteers, but we can't have volunteers making a local exhaust system, right? I mean, it comes down to money at some point.
Well, I think it relates to the capacity building aspect of this, right? If you come in and fix a problem, it's like, give them some fish versus teaching them to fish. If you can ingrain the culture and you can have someone there who has enough savvy to keep the equipment going, then that's necessary, right? And then they can do it for the people down the street, and that's sort of, it could grow that way as well. But you have to have those people.
We have one member in the U.S. group who is proposing working with Rotary clubs in India. In general, he's worked with some, and they're the ones he's worked with, are very open to promoting their small business owners. So that's one way of maybe facilitating networking kind of thing. So I think that should be made
Well, in church groups too, right? Any way that people normally network, any social network you could conceivably tap into. Other questions? So, for those who are in the industrial hygiene program taking the ventilation course, so I attempted, Jonathan Klain is the guy at Arizona State who's heading up this effort to build the LEV system, and he's brought engineers at Arizona State in on the problem, and we're sort of on the outside trying to kibitz and help a little bit, but you all should have been made aware through Greg Grubb of this problem, and we were hoping we could promote it as a little project you could think about or on the side of that class. So I don't know if it's gotten any traction, but that's one thing to add.
Yeah, Engineers Without Borders is a great group to partner with.
Yeah, we have a campus
one
group
here.
of engineers.
And I understand you have something called Sustainability Without Borders. Is that even here? Yeah. So what kind of things are you doing? What's that group doing?
No, I don't see it. They're doing sand filters, mostly water supply work.
I'll show you the website.
Okay, all right, yeah. I think it's a huge potential for partnership there. We were approached, by the way, by Engineers Without Borders at Columbia University doing a project in Uganda. And here's, I think, a good example of where we can bring something. So they approached us only because they wanted our advice about respirators. Because they were there to design machines. They were installing machineries to help the communities process agricultural products, essentially grind up grain. And they said the dust levels are really, really high, so we want respirators for them. So they sent us a bunch of pictures, and we looked at them, and we said, you need a better local exhaust system, before you need respirators. We can help you with respirators, but, that's not your first, the usual hygiene hierarchy. And, of course, they didn't know what to ask for, right? They thought they had one problem, but, this is very common in what we do, right? So I think partnering with Engineers Without Borders can be really, really valuable, because they may be already doing things that would really benefit from an occupational health and hygiene perspective, and they don't even know it. So, again, there's the subtlety of how do you, convince somebody that they need what we've got, but it's really worthwhile connecting them.
Anything else? All right, well, let's thank Marianne.